Hello, everyone. My name is Jose Cataneo. I'm a PGY3 surgical resident at the UIC Metropolitan Group Hospitals in Chicago, Illinois. Now we're presenting our project called the Impact of Fellowship Training on Surgical Outcomes After Appendectomy, a retrospective cohort study. I have no disclosures. To start off with a brief background of why we decided to conduct this study, the benefit in outcomes from laparoscopic compared to open approach has been widely studied in large multicentric studies. And in addition to the current trend of graduating general surgery residents to pursue a surgical fellowship, approximately 80%, we wanted to evaluate the impact that this has in a common surgical procedure. And in addition, outcomes studies have failed to show that there's a significant benefit from having the skilled laparoscopic or self-specialization approach. So the study aims to answer the question if laparoscopic trained surgeons have better outcomes compared to the general surgeons while performing appendectomy. The hypothesis was that fellowship trained surgeons with advanced laparoscopic skills would have better surgical outcomes and perioperative factors as compared to general surgeons. Our study sample, we retrospectively reviewed from a single institution adults undergoing appendectomy from 2008 to 2017. All of the patients included were seen by the surgical team, and they had a CT scan with findings suggestive of acute appendicitis. Basic demographics, comorbidities, and 30-day complications were analyzed. As we can see of the two main groups that we have, on the left side, we can see the fellowship trained surgeons. We have a colorectal surgeon and a minimally invasive surgeon. Well, for the general surgeons, we have 6 in the comparison group. For the statistical analysis, we initially ran a normality test with the Shapiro-Wilk, and depending on the results, we ran a Wilkinson rank sum or an unpaired t-test. These continuous variables were described as means or medians, while categorical variables are described as frequencies, and we ran a Fisher's or a chi depending on the tables. A stepwise multivariate regression analysis was done to evaluate the effect size of these risk factors. And in the end, we did a subgroup univariate analysis only focusing on laparoscopic approach between the fellowship trained and the general surgeon. We can see in table 1 of our baseline demographics that in the end, there was no statistically significant difference between our groups, and we can see this reflected on the frequencies. We also decided to dichotomize the variables as known risk factors, 1 for statistical analysis and 2 for better interpretability, but we can see that there is no significant difference between our groups. For surgical outcomes now, interestingly, we see that major complications is not statistically significant for difference between our groups. We see then on ileus that general surgeons had an increase in incidence in the number as compared to fellowship trained. For perioperative variables, in a way expected, fellowship trained surgeons, most of their cases were done laparoscopically, while for the general surgeons, they had a higher frequency of having an initial approach as open and also conversion to open, 7.55% compared to 2.67 from the fellowships. This also reached statistical significance. Interestingly enough, length of stay was also statistically significant, but we can see on the table 1.87 versus 1.82, which we will discuss later if this has any clinical significance. On the regression analysis, we can see that diabetes mellitus increases the probability of having major complications in appendectomies regardless of the approach, while laparoscopic approach is a protective factor against major complications for appendectomies. General surgery versus fellowship did not reach statistical significance in this model. And for our final subgroup analysis, as we can see in this table, nothing is statistically significant, even though ileus showed a trend for higher ileus in the general surgeons. Summary of the results, we found no statistically significant difference in major outcomes between fellowship-trained and general surgeons performing appendectomies. General surgeons appear to have higher rates of ileus, conversion to open, choosing an initial open approach, and a longer length of stay. Diabetes was found as an independent risk factor to develop overall complications, where laparoscopic approach was seen as a protective factor. No difference in intraoperative time was seen in the main study groups. The limitations from our study is the unknown years of experience from the general surgeons as well as the fellowship-trained surgeons. Both groups performed their appendectomies using assistance, as this is a teaching hospital from residents of unknown number of years in training, and also the independence that this was done during the procedure is unknown. The difference in training from the laparoscopic trained surgeons between the colorectal and the bariatric surgeon also may confound the results from this. And an important thing that even though we reached statistically significant difference for length of stay, in the end, doing the mathematics, it turns out a difference of 79 minutes. Even though we reached statistical significance, this may be due to the non-parametric test that we had to run on the length of stay in days. The conclusion that we found from the result is that the study appears to show no difference in composite major outcomes when comparing general surgeons to laparoscopic trained surgeons performing an acute care surgery, especially in the minority predominant population as it is in this inner city hospital. However, we did find that open surgery and conversion to open was utilized more by general surgeons. Even though certain factors did not reach statistical significance, the importance of laparoscopic approach being a protective factor may also influence other variables. However, further studies are needed with higher power to see if there is an important clinical correlation. These are the references. Thank you for your time.